Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes, creating a kind of video of writing in which everything would be there, including the connectors, the grammar. I will try to include everything because this letter even I have not done before. And if you see this letter, there is no recording of this letter as well. So this letter I will upload by the name of uh, the patient, that is Jack Peterson. So I have not done this letter before. So I will try to consider every point, including the time. This is like a final exam I am attempting. Where to start, how to start, I will tell you everything. So first of all, when you take your exam, you read the information from here. The first information you read from here. Using the information given in the case notes, write a letter to Mrs. Cullen, a university practice nurse. That means a nurse who is working in university. In your letter, briefly outline Jack Peterson's history and your concerns. Address the letter to Mrs. Cullen, Monica Cullen, senior nurse, practitioner, University of Marchbank Health Center, Hills, Dune Road, Marchbank Road. Done. So that means I am writing the letter to senior practice nurse of a university. That is the first information I need to whom I am writing the letter. The second thing I read is why I am writing the letter. So this is the purpose. Student concerned about transition to university shortly means he must be completing his school and he is in the transition phase where he will be joining the university shortly and independent living. So he is concerned about joining the university, which is in a very short time, and he is concerned about independent living. So letter to university medical practice to monitor him and organize special exam arrangements. So this is my main purpose. So even if I have to write this letter, then I can simply write it this way. With this information, the purpose of letter is all done. So I will try to have it. So I'm taking the information from here and will tell you the complete letter, how to write it. It will take bit of time, but again, not much. So MRS, it will cover everything again. MRS, the name was Monica Cullen, Monica. Very careful about the spelling. Senior practice, senior nurse practitioner. Okay, senior nurse and capital P capital. So I will tell you each and thing, including the grammar. Please, this letter would be like your final day preparation. So I'm doing everything for you. Just require your concentration, and that's it. University of Marchbank, University of same whatever is given, University of, oh, I do not want capital, rest I want capital. Marsh Bank Health Center. So I will write the complete Marsh. You will write the complete thing. Health, H capital, H capital, Health Center, C capital. So that is what you will write. C capital, whatever. And complete this word as well. It's a big one, so I'm not writing it to save time. Then Hills Dune Road, Marsh Bank. So Hills Dune Road, Marsh Bank. So that is how you write the first thing in your final exam. Then you write about the next thing. Dear Mrs. No, you write today's date. So I want to write today's date. What is today's date? 30th August. Today the student is concerned about transition to university and independent living. So okay, today's date is 30th August 2019. So I'm just telling you how to simply write your letter, and it would be much easy to write this way. Then you write, Dear Mrs. Cullen, and then K should be capital. I think by chance I have done it. Yeah, it should be capital. Then you write regarding I'm writing this patient, so I need the patient's name. So I will write it from here. Jack Peterson, date of birth 17, 18 years old. So Jack Peterson, 18-year-old. Mr. Jack Peterson. It is just on the edge line. If it would have been 16 or 17, I would have written otherwise, but I am taking him 18. So that's it. So now my format is complete. By chance, if I do this, and leave one space line and I put it here, this last two things do not matter. So if by chance you write this thing again from here to here, these last two things can be interexchanged. It will not matter. Now, the pattern. That is how now you will see the easier side of OET. This letter is being written regarding Mr. Peterson, P capital. Don't write it small, Peterson, who is, what is the main thing? Who is joining? Who is concerned about transition to university? You can write the same line. Who is concerned about, same line, concerned, make bit of verification about joining the university and remove the word like shortly, which try to make you confused, and is also worried about living arrangements. So I'm telling the senior practitioners that this is the main problem of this person. Therefore, so that is how easy the OET thing is. Don't overthink. Therefore, he is being referred to you for monitoring him and organize special examination and to help him and to assist him in organizing special exam arrangements. So that is the main problem he is having. I will try to make it better, but this is the major thing that I have found in the first paragraph, that he is concerned about his living arrangements and he is concerned about his exam. So you are requested to monitor him. And that sets up the tone that you are at a place where you can easily pass. Even for the doctors, this letter would be handy. So this can be from the doctor to telling the senior practitioners that you have to take care of this kid. So this can be this thing. Now just read the whole letter in one go. Now it will not take time. Just in one go, I will read everything. Assume that today date is 30th August. We have already taken is 30 August 2019. Did I write it 2019 as well? Yes. So it's all good. So now read the whole letter. You are a nurse at a boarding school. So the if we talk about Jack Peterson, he was studying in a boarding school. That means he used to stay there almost the whole day. Is a male student at your school has come to you complaining of hair loss and associated depression. So that is the main thing, that he has come to you regarding the hair loss, and we are a nurse at a boarding school. You can be a doctor as well. Again, this similar kind of a letter can come to doctors as well. Then Jack Peterson, 87-year-old, Holy House School, Brankridge. And this also I will tell you, we will utilize this at the end when we will say you are sincerely registered nurse, Holy House School, Brankridge. So this is, we will also write this thing. So nurse at boarding school. So social background at a boarding school for past 8 years. That means student was here for the past 8 years. Parents work and live abroad. So there is nobody to help. Father, male pattern baldness, onset in 50s. Mother, depression, onset in 40s. So that is why he is having mixture of both father and mother. That so these two history becomes important, because father has history of hair loss, baldness, and mother has history of depression, and he is having both the things at the moment. So non-smoker, 20 units alcohol per week, so not too much. Karate belt, champion swimmer. That means he's an active child otherwise. And presenting complaint. This is very important. Alopecia, hair loss from 13 years old. So that means now he is 18. That means he is having the hair loss problem since last 5 years. 18 minus 13, 5 years. Intermittent cycles, loss and regrowth. Etiology not confirmed, various possibilities. Depression, seems to be a case of depression, but not for sure. So never write that these two things are connected. Sometimes you write due to depression. No, it is not due to depression. This question mark means that he may be depressed at the moment or he may not be. So we should not connect these two things, and might be depressed. So question mark you should write might be depressed. Now summary. So today is 2019 August. So March 2014. He has been a school student for 8 years. So 19 minus 19 is today's date. 14 is this. So that means 5 years ago, he presented to the school clinic, hair loss in patches, anxiety, maybe onset school bullying incident. Patient said not a major thing. School bullying incident was there. Maybe that's why, due to the stress, he lost the hair in the anxiety. But onset we do not know. Referral to trichology specialist in March 2014. Then March, April, May, after 2 months, no etiology established, possibly exacerbated by stress. So maybe the stress was the reason of anxiety, or maybe the hair loss. So we prescribed steroid treatment, betamethasone, for 3 months. Personality changes, aggression, sleep loss, medication discontinued. So he was having some personality changes, there was aggression, and there was loss of sleep, and medication was discontinued. Then 14 to 18, that means in the next 4 years, no further hair loss, intermittent hair regrowth. So that means everything became fine. So he was all fine. Then in December 2018, today is August 2019, that means almost 9 months ago, return of anxiety, and there was pronounced hair loss. So again, now I understand this hair. Now I'm 100% sure that anxiety and hair loss are connected. So now I can make an easy letter that return of anxiety and pronounced hair loss. General health check. So weight was less 6 kg less over the last 2 months. He has got loss of 6 kgs. Recommended to see a doctor regarding hair loss, anxiety, weight loss. Student reluctant. So he was told to go to a doctor, but he was reluctant. Asked about natural remedies like homeopathy. Discussion regarding the efficacy. Students still keen to try. So in December 2018, he wanted to try homeopathy. Didn't want to see a doctor. Feb 2019, that means January, February, after 2 months, no result, plus cost implications of homeopathic treatment. Student increased distress and low mood. So he lost his money. There were no results. So he got even more depressed, even more distressed. Problems forming, maintaining peer relationships. Now he is unable to make peer friends. Peer means friends. Now he is unable to make relationships. Affecting sports participation. So he's a swimmer, getting all the things wrong now. Referred to school counselor, did not attend. So in the March, we recommended that you should go to a school counselor, but he did not go. In May, checkup, increased alcohol consumption. So now he's probably having he's having problem of alcohol consumption as well. June to July, exam time, extreme anxiety, necessary to arrange separate exam room. So we had to arrange separate exam room because he was having extreme anxiety, and there was increased hair loss as well with Jack Peterson. So these are the problems he has faced. Now the student is concerned that how would I go to university? And letter to university. So we have told the senior nurse practitioner that this is the problem. This is the Peterson's history. So I have to mention the history, and to aware about how to make the special exam arrangement. So now I understand almost this letter very nicely. And you have what you have to do. Now you write in a flow according to what has been given. So now I will tell you. So first of all, I will consider the social history. So Mr. Jack, school boarding for the past 8 years, parents are away, that is the main thing. So now I will only include what you find is very important, Mr. Peterson. Now tenses will play a very crucial role in your marks. So I'm telling you tenses as well. Please listen to it very carefully. Mr. Peterson has been a student at boarding school for past years. I am the nurse at the boarding school. Has been student of our boarding school since last 8 years, and his parents live abroad. So now just write the most simplest way. The simplest it would be, easier it would be for you to pass. So now you're writing a very simple thing, that this and this abroad. Nothing else, nothing. That's okay. Presenting complaint, alopecia, hair loss from 13 years, intermittent cycles, and etiology not confirmed, and it can be depression. So now I can relate two options. After reading from here that depression and anxiety and hair loss are coming together. After reading from here, only then I am including it. So yeah, just a second. I have lost the thread. Yeah, just a second. I have to take it again. Sorry. So what I'm saying is to make it very easy and take only the data which is very, very important. So do not write anything extra. Do not overdo things. And let's go to this thing again. Okay. There is some problem with this. I am unable to stretch it. Don't know why. So I will take it this way only. So you have to pay more attention to this. Alopecia, hair loss from 13 years, and spelling of alopecia is important, and intermittent cycles, etiology not confirmed, might be depression. So he has history of hair loss since he hair loss and intermittent regrowth, or he has history of alopecia. Let's write simple again, not making it complex. Sorry, again, even I get into that complexity, then I have to tell myself make it easy. His history of depression since he was alopecia loss since he was 13, and its etiology is not confirmed, and it might be due to depression. So now I'm relating these two things because I can see the whole letter that these two things are interconnected at all the time. So this is the main thing that is happening, that he is having depression, alopecia, 13 intermittent cycles of loss and regrowth. Then March 2013, I have to make it better. At last I have to do something about this because I'm unable to stretch these things. Obviously it will be difficult for you guys to, I'm unable to stretch it. I don't know why, what has happened. Okay. So March 2013. So now I will go according, now all the paragraphs will go in a simple way. School clinic presented with hair loss in patches, anxiety. So in March 2013, he presented for the first time with hair loss in patches. So he was referred to trichology specialist. Don't write everything, just write he was referred to trichology specialist. So he presented for the first time in 2000, in March, easy 2014, he presented for the first time. It will not take time if you will write the only the easy thing, first time due to hair loss. So he was, this is the connector, simple. In 2014, comma, he presented for the first time due to hair loss, so he was referred to trichology specialist. Again, only the easy thing. Don't write too much. You will feel like writing everything, but please don't write everything. Please, trichology specialist. Whatever the word has been given, use only that word. So that's done. So this is done. In May 2014, no etiology was established. So March, April, May, in 2 months, no etiology was established, possibly exacerbated by stress. So steroid was recommended. So no etiology was established. Passive voices was established, and possibly exacerbated by stress. And the possible, simple, again, this is difficult line, so see how simple you can make it. The possible reason seemed to be stress. Now I want to write so, but why to repeat again so? So I will change the connector, will make for which, simple again, for which steroid was commenced. This is my word for the starting of a thing. So steroid was commenced. And this happened in the next 2 months. No etiology was established in next 2 months. So now I have related to March to May, that in the next 2 months, no etiology. From 2014 to 18, there was no thing. From 2014 to 2018, there was no hair loss. Now this is my third paragraph. So I can make 4 to 5 paragraphs, but see how simple this letter is now for the examiner to pass you. So this is how simple it should be. Now I'm trying to mix up with the next page. Let's go to the next page. Let's see the other information. So when I see this information, return of anxiety and pronounced hair loss in December 2018. So the letter is going in flow. Now I talk about liner D capital. In December 2018, hair loss. He again complained of hair loss. Let's make it more simple. He again complained of hair loss. Now write only main things, because now you have more words to be written, but write only hair and return of anxiety. Complaint of hair loss, complaint of anxiety again, and hair loss. So you pronounce hair loss. I would also like to write the word pronounced, means too much of hair loss. Yeah. Now hair loss, 6 kgs over the last 2 months, and lost 6 kgs over the last 2 months. Again, I just want to make my exam the easiest of the exam for the examiner, so that he can say that this is the easiest thing that any could have written for him. So now this is done. Recommended to see a doctor regarding these issues, but student was reluctant and asked for natural remedies. So he was advised to see doctor, but he was reluctant. But now I am trying to say my words, but he was reluctant. So homeopathy was recommended. Was recommended. Okay, so the homeopathy was recommended, or he asked for? Asked about natural remedies. Okay, so homeopathy was recommended as he wanted. Now I'm saying as he wanted natural remedies. However, now this is, I'm changing the word from, if I'm using but now I'm using full stop. So I'm using however in place of but. However, what has happened? However, there were no results and student became more depressed and low in mood. However, there were no results and due to post implications, he became even more depressed, more distressed. He became more distressed. That is how natural English is, like very simple. Don't make again anything difficult. He became more distressed, and what has happened to him? More distressed and low in mood. So these are the main things. Now talk about the current problem. So you have to leave all this data which is extra. Refer to school counselor. He did not attend. In March 2019, he was referred to school counselor, but he did not attend. So when I'm using comma, then I use but he did not attend. So that means he is reluctant. Checkup and alcohol consumption, exam time, extremely anxiety. From July 2019, from June to July, sorry, because it's August now. So June to July 2019. So commas I need after June, after July. And then that he had extreme anxiety due to his exam. Due to his exam. So a separate room was arranged. Separate exam room was arranged. So I use simple connectors. and simple passive voices, was, were, third form. So this is the thing that was done. That's it. Almost at the finish of the letter. So now the last thing, last line, and increased hair loss. So in this turn, also in this period, he suffered from. That is how you simply write. Also in this period, he suffered from extreme hair loss. Even you can see that even after shredding of so many words, still my letter is not that small. So you can well understand. Now I can mix up these two paragraphs to make it one. So now I will simply write now. He is worried about this. Now he is worried about or concerned about his transition to university and independent living. Main words and independent living, for which your expertise is highly. That's it. That is your letter. Complete letter with complete format and everything you need. Then should you require further information, feel free to contact. Main thing I have already written, that exam arrangements and monitor him, that I have already written. If I want to repeat it, if I would have words, I would have repeated it, but I do not have words, so I'm not repeating it. So feel free to contact. That's it. All done. And the time I might not have taken around 30 or 35 minutes. Complete letters. Yours sincerely, because the name is given of both of that person, Monica Cullen. So I will write yours sincerely, registered nurse, and the name of the school is, that is where I wanted to tell you, that Holy House School, Brankridge. Holy House School, Brankridge. This is very important to be written because I want to tell you that I belong. That is why, because I have written the word or our over here. Our means this school. So now this is my complete letter in the complete format of OET. This is how much OET letter has to be. That's it. So it has to be that precise, that easy to write OET letter. And please again, it depends upon how willing, how much willingness do you have to pass. So with complete willingness, a small letter like this can take you to UK very easily. And please write it as less complicated as possible with right connectors, commas, and everything. So I'm saving this video. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you very much.